All right.
All right. Well, good afternoon, everyone. My name is Maureen Kinney, and I'm the Campus Partnership Project Manager at SUNY Online. It's my pleasure to welcome you to today's Open Education Week webinar. We're pleased to host Dr. Donald Nowak from the University of Buffalo to share about AI and online mental health counseling classes. Dr. Don Nowak has been an associate adjunct professor at UB since 2012 and has also taught counseling at Niagara University and Johns Hopkins University after working for several years in the mental health counseling and addiction field. He received his master's in mental health counseling from UB in 2009 and his PhD in counselor education from UB in 2014. Dr. Nowak's current research interest includes exploring issues around counselor wellness and readiness for the profession. Most recently, he has begun researching the implementation of artificial intelligence in mental health counseling, as well as in counselor training and clinical preparation. He is a lifelong resident of Western New York and is also currently working as a consultant for online program development and course construction and design. Welcome, Dr. Nowak.
Thank you very much, and thank you everyone for being here. I'd like to, preface my remarks as saying, while I'm talking about specific instances in mental health counseling courses online, a lot of this is applicable to many other areas, including education and the health professions. I'll talk about that near the end of my presentation as well, but let's get started. So exactly what we hear about it all the time, especially lately in the last year or so, but what is artificial intelligence? In short, it refers to computer systems capable of performing complex tasks that historically only a human could do, such as reasoning, making decisions, solving problems, and even having conversations. The founding father of this discipline, John McCarthy, described this process as that of making a machine behave in ways that would be called intelligent if a human were so behaving. There's a couple different types of AI, and I want to go over a few of them and then discuss the one that's probably most relevant to my topic and in education, online education. Um, Machine learning is a subset of AI that involves developing algorithms that allow the systems to learn from data and improve their performance over time without being explicitly programmed. Supervised machine learning, in that SML, the data are pre-labeled beforehand. For example, distinguishing between diagnosis of major depressive disorder and the absence of depression. So there's some labeling, there's some categorization going into the algorithms that isn't necessarily done in just regular machine learning. In unsupervised machine learning, these algorithms function without predefined labels, enabling them to detect similarities among input features and unveil the inherent data patterns. However, they lack the ability to associate features with a known label. So what that means is looking for similarities and commonalities among data, but not necessarily being able to label it yet, but it can find out and sort them. In artificial neural networks and deep learning, those are based on the structure and functioning of our own human brain. And deep learning involves handling complex and raw data without human guidance by employing artificial neural networks that resemble the manner in which a human brain thinks. And as a someone in the psychology and counseling field, that I find that fascinating. Certainly, certainly in the way that these are resembling how our brain works and operates. But as far as the AI's most promising usage in mental health counseling, and in other fields as well, natural language processing (NLP) is yet another subfield of AI that enables machines to process, comprehend, interpret, and even generate human language. And I'll talk about assignments that I've designed utilizing this. Researchers refine and make use of such of these tools in real world applications creating spoken dialogue systems and speech-to-speech translation engines, mining social media for information about health or finance, and identifying sentiment and emotion towards products and services. So NLP can significantly aid in analyzing written or spoken language to detect emotional states and changes, assisting clinicians monitoring patients' mental well-being through text, chats, or speech. And that's a lot of times what counselors are doing. This detecting the emotional states and changes. The NLP is able to do by looking at text and emails and real time audio conversations and the like. Here are some well-known AI applications. Probably the most well-known, of course, is GPT. But there's others that are very specialized. WISA is a mental health care app, which I'll talk about a little bit later. Copilot, considered maybe the best alternative to Chat GPT, and that's a Microsoft-based application. There's Claude, which is a lot for doing images and design. Jasper is used in business and marketing, and Socratic is for kids and students. So there's many different applications out there. I haven't even mentioned one that I use the most, which I'll touch on. But there's a lot out there right now, and that's why it can be a little bit overwhelming. So how can AI be used in mental health counseling and training mental health counseling students online? Um, so tech companies raised billions of dollars in the last several years just for looking at mental health apps. It can be used in diagnosis to differentiate closely similar disorders. Some of the assignments I'll talk about are based on diagnosis, and so this can translate easily to nursing, the medical field, other realms of counseling like rehabilitation counseling, school counseling, and the like. But as far as using AI in diagnosis, it can parse through the variability found in human expression data and potentially identify different types of depression or various disorders. A lot of times it can do it well in advance of a clinician being able to make these determinations as well. It can be used in prognosis to create accurate predictions for disorder progression once diagnosed. In psychiatry, many cases, multiple drugs are trialed with the patients. This is very common in depression. And using these until the correct combination or regimen is reached to effectively treat the ailment. AI could theoretically be used to predict the treatment response based on already observed data without having to have the client say, take the medicine. It can sort of predict. And then you get into stuff about genetics being used in medicine. So in psychiatry, that's a big deal because a lot of times in depression, especially as I mentioned, they just take a bunch of different pills, throw it at the wall, so to speak, and see what sticks, what helps and works for the client. And that takes lots of time and lots of iterations. Right now, the most practical use of AI, not just in mental health counseling but in many different areas, is the clerical. AI can be used for taking notes, transcribing, writing up treatment plans, taking care of appointments, setting up reminders, and sort of the everyday day-to-day stuff that mental health counselors do. So how do we want to educate students about the benefits of using AI in mental health counseling? And as I said, this is also applies to educating students about the benefits of using AI in any type of situation, really. I'm just particularly tailing it to my area of expertise. But it helps improve the accuracy of diagnosis, in some cases quicker, easier, and more accurately than a clinician. It can improve access to mental health care, and it gives intelligent monitoring and early warning signs. I'll talk about suicidal ideation being detected early with AI. Chatbots and virtual assistants can be used for customer care, for scheduling and organizing information. And here, predictive analytics for suicide prevention. There's algorithms in some of these AI that can take a person's speech, analyze it, their communications, whether they're text, email, speech, whatever, and be able to even come up with like a percentage. Like this person is a 80% chance of uh, attempting suicide. But also AI can be used in data-driven decision making and objectivity in assessment, because when doing assessments on clients or patients, we all have our own biases and stuff that comes in. This takes away a lot of that, and there's a trade-off that I'll talk about when I talk about some caveats. So here's some areas in which mental health counseling where artificial intelligence may work best. The very basics of what we do, the very basic things of what we do as counselors is psychoeducation, just providing basic self-directed education on preventative topics in healthcare, as well as informing of the consequences, say, of addiction, etc. That could be a lot of self-directed courses, self-directed modules, and such. That's just pretty much providing information, not necessarily giving any direction, but just providing information. Hence the psychoeducation title. In eating and anxiety disorders, AI-powered therapeutic games and virtual reality experiences can provide immersive environments for practicing emotional regulation skills that are necessary for recovery, both in anxiety and in eating disorders. So there's ways to gamify it. You can use VR, virtual reality, to help clients be able to practice some of these things. And in some of the assignments that I'll talk about, we get students online to be able to practice some of these techniques and therapies without having to actually, have the dealing with an actual person, actual client or patient. That may come later when they're in their internship, their practicum, and their internships. With autism spectrum disorder, AI-driven tools can assist in early detection by analyzing facial expressions, eye gaze, and gestures during video based. So this is a lot of this is video, obviously, but it also obviously will do, audio and speech. But by doing some of these other things, video based interactions, this can aid to identify and in the intervention of autism spectrum disorder in young children when it starts to manifest itself. With schizophrenia, automated speech analysis can assess speech patterns. So here again, the AI is looking at existing data of speech and writing and audio and video, can assess speech patterns and prosody to detect subtle and clinically relevant affect-related changes in speech that might indicate the onset of schizophrenia symptoms. A lot of that happens in the late teens, early 20s with both men and women. I think with women, it might happen a little bit later. With men, we're looking at late teens, early 20s, and a little bit later with women in these cases. But NLP-driven tools can assist in tracking and predicting relapses just based on the speech patterns and emotional content. So if you're recording, say, doing in an online, we do a lot of telehealth practice because a lot of students will be going into that, and these can be, with the client's permission, of course, recorded, and then the AI can analyze the speech patterns and the gestures and facial expressions to make all these predictions. And we'll talk about what these predictions may or may not mean. As someone myself with parents in their late 70s, in elderly populations, AI can assist in dealing with feelings of isolation, cognitive decline, and age-related mental health issues. AI-driven virtual companions can offer companionship and engage older adults with cognitive exercises and reminiscence therapy. Additionally, AI-powered sensors can detect changes in behavior to alert caregivers or healthcare providers to potential emotional distress or cognitive decline. And I do see AI being used a lot with the older population once maybe they get a little more accustomed or more comfortable with it, because it can provide a level of interaction at a certain level where someone might not even know, maybe an adult with cognitive issues might not even know that it's not a real person that they might be communicating with or texting with or interacting with on a computer. But it does have that potential. So what I would say, what if I was educating students about the challenges of using AI in our field, that applies to every field really, these challenges, is protecting client privacy. As we know, or at least we are told, not to put too much personal information when interacting on AI platforms. So how can we assure client privacy of information? And that is a challenge, and I don't know, what exactly the answer to all that is yet. And that ties in with data protection and informed consent. How do you as a client, as a clinician, let your patient know that your content of your conversation might be recorded and might be used with AI analysis to help as assisting the clinician. Um, Another challenge is the insufficiency of diversity, which ties in with a lot of other things, but because the way the algorithms work with input being used to generate and generative AI, it will need a lot more people of diverse backgrounds, ages, races, sex, gender, um, socioeconomic, to be able to be fully conversant, and not give wrong or erroneous or inappropriate information. And that will also take time. Now, that time decreases probably with each year that the technology gets quicker and faster. And another challenge is the apprehension of both providers and agencies and even clinicians to even want to use this. There's certainly are a lot of people that are still very reticent about it, and there are reasons to be reticent about it, and I'll talk about. Um, to do the Tarasoff duty and informed consent and explanation, that is the law that requires clinicians to have to warn someone if there is a imminent danger from their client. So AI may be unprepared to do these types of things that we counselors do on a regular basis and have the duty to do. How does that factor into, an AI even being programmed to do that, or will it when it will know when and how to do it? In talking about criticisms of AI, particularly to mental health counseling, but in other fields too, it's the ethical issues. Is it even ethical to chat with a chatbot about your mental health issues when you're not sure about, this isn't really a person? Are you even going to get correct information? Well, might it offer harmful advice? And there's a couple cases about that. The lack of empathy, which is in our field, it's the main thing with the next tied in with the next point, which is the therapeutic relationship, a loss of it. But the therapeutic relationship and empathy is what connects the client and counselor and keeps them coming back for more, and more sessions, to do more work, to do more, and that working relationship. The therapeutic and the empathy is what generates that and keeps it going. As I mentioned before, the lack of data, and something new there's just that's working on information being put in. The lack of it is something that a lot of the assignments that I'll talk about is tied into, looking for those gaps in the knowledge. There's bias, just as anything. The bias that from programmers, the bias of perhaps the people that are inputting information into the AI chatbots, that it's all using as part of its algorithms and in its learning. Um, there's accountability, there's reliability, there's regulations. It's all the kind of stuff that in a wild west of artificial intelligence applications, there isn't a whole lot of regulation. I know that's all of these things are going to have to be addressed before it starts being used on a wider basis in any field where you're dealing with people's health. And then, of course, harmful advice. Sometimes, the AI chatbot will tell a person to kill themselves. And in a few cases, the person has done it. Not, I will say that is not in mental health counseling apps or some sort of self help apps. It was more sort of just some, chat. There was a incident, I think, in Norway and one in another country where um, the AI was encouraging the person to harm themselves. So the monitoring and the regulations are certainly first and foremost in our minds. Some current trends and usages of AI in mental health at Vanderbilt. They developed an algorithm that uses a person's hospital admission data, including their age, gender, and past diagnoses, to make an 80% accurate prediction of whether this individual is likely to take their own life. And that's what I talked a little bit earlier about suicidal ideation, predicting that, using all these different factors to be able to have that accurate of a prediction will help for interventions and getting the person the attention and the treatment that they might require. At Cedars-Sinai, they developed a first in its kind program that uses immersive virtual reality and generative artificial intelligence to provide mental health support. And that would be like people who are in recovery from addiction or dealing with other mental health disorders and have an ongoing support for them that they can check in with. At USC, they were researching the effectiveness of a virtual therapist named Ellie through using a webcam and microphone. This AI is able to process and analyze the emotional cues derived from the patient's face and the variation in expressions and tone of voice. These are the type of things that counselors are always aware of and doing while they're listening to you talk. The therapist is also looking at your hand gestures, your facial gestures, your tone of voice, your method of speech, all these factors. And that's a lot of different things to be thinking about all at once. It's certainly easier, I think, for AI to do it than for a therapist, especially a new one that we're training as a student. And that's why we have assignments that will address some of that. At Stanford, they have what they call Wobot, which is an app that makes therapy sessions available 24/7. It tracks their users' mood through brief daily chat conversations and offers curated videos or word games to assist users in managing their mental health. Now, to get to the heart of the matter here, this is some usage that I've done and assigned and developed assignments in using AI for counselor education and training. One of them, using AI as a fast and easy way to come up with a list of articles to use for a lit review. If they were going to do a paper or working in, say, a course in research and evaluation or a course in assessment, they're going to have to do a lit review. They can use AI with with the proper directions to come up and generate a list, as well as judging it for the accuracy and appropriateness. So they're asked to use AI to get a list of peer-reviewed articles on a specific topic for their lit review. Say they might ask the AI, give me a list of peer-reviewed articles from journals between 2020 and 2025 related to gambling disorder in college students. And it will come up with, you'll get it, it'll only take a few seconds, you'll get a list. The students will then review and research the results and indicate which ones and how many were relevant to the topic request, because you might get some that are relevant, some that aren't relevant at all, and some that are, some that are very pertinent. If some weren't appropriate, we have the students indicate with specific reasoning why and assess the overall results. So in a way to do research, this is one of the more basic ways of using AI, but they can still see that the list isn't going to be perfect. There's always going to be stuff in there that they'll need to sort through. So there is some work for the student, not just in doing this, but to come up with stuff, say why this didn't work or why this wasn't appropriate. One of the other assignments, this would be in a class where you're doing diagnosis, such as psychopathology, or even in some of the clinical courses, the internship and supervision courses, um, asking an AI app for an explanation, opinion, or specifically a diagnosis of a particular issue or disorder, and then critiquing it for accuracy with citations. That's the key. They can always already generate, use the prompts and generate something, but then they have to look at it. By inputting the symptoms with the assignment, they'll be given, different symptoms and explanations and supporting information, things like age, race, gender, etc. Students will ask the AI to provide a provisional diagnosis for a mental health disorder. Students will then decide if the AI diagnosis is correct or partially correct. And if any differential diagnosis, that means like a provisional, something that it could be associated with it, or other considerations need to be accounted for. So then students will then provide citations and supporting evidence. Specifically, they would be quoting probably from the DSM, the Diagnostic and Statistical Manual of Disorders, to either affirm or amend what the AI comes up with, and then discuss the experience in a short paper. That's in this case, you could give students various different symptoms, and then the real work for the student is having them ascertain, well, is this really schizophrenia, or is this schizoform disorder, or is this where might this client be on the autism spectrum disorder, on the spectrum on there, and just to be able to go through and see where the AI might have been right or wrong compared to what the student thinks, and then having them buttress it with citations and doing the work to determine the accuracy and specificity of these diagnoses. One of the most interesting uses of AI in the training, and that can be used in any type of field where you're interacting with patients or clients or people in general, is in this mock counseling. Now, the AI application that I use is pi.ai. It's just simply what it is up there, pi.ai. Students are asked to use techniques such as motivational interviewing, which is a technique used with people mostly in recovering from addiction and substance abuse disorders, on a mock client whom they've carefully instructed the program to portray. In these classes, students are in a lot of our training courses. Students are often asked to pair up in dyads and do mock counseling sessions where one portrays the client and one portrays the counselor, and then they might switch. Sometimes, though, the nature of these can be triggering and difficult for some students to do, as we're not trained actors. I would always say this isn't, inside the actor's studio. We're just practicing being counselors, and it's hard for a lot of people to be clients, especially those in distress. And I've seen some very emotional instances in classes where students portraying a client, say, who was portraying a client who had experienced abuse of some sort, and it can get very triggering for the student portraying and very emotional, and sometimes it gets into real life situations, and it can easily spiral out of control where the instructor has to step in. But when we use AI to portray and respond as a specific type of client, can help students practice counseling approaches and techniques in a more safe area. And it will speak as the person. If you can say, I want you to portray a 30-year-old Latina who is ambivalent about coming into therapy for alcohol use disorder or something. And you can give it, the more specific you are in the input, the more specific you'll be with the output of the chatbot and how it's going to interact with your student as they try to practice various counseling approaches and techniques. Students can then copy the text of their conversation with the AI and provide it to the instructors. In this assignment, they would send me a word copy of their conversation, and then the important thing is they can comment and critique on what they said and what they could have done differently. And the instructor in their comments can say what they did well. You did this technique well, you did that technique well. And then these can also be shared on, to say, on a discussion board with classmates for peer input. So you could have multiple different types of disorders that you're interacting with, and have students be able to critique their fellow students. Oh, I really liked what you did here, or maybe you could have tried this. And it's the same type of conversation you get going in a discussion board that you would get in a live classroom when we would do these types of exercises. This approach has been very well received in terms of mock counseling with clients suffering from post-traumatic stress disorder, or in an active crisis, say witnessing a shooting, a natural disaster, a sudden death, or so on, as these can be particularly troublesome doing live with another student because of the nature of the problem. And this has been one where the students have actually been thankful that they've been able to do this interaction on AI rather than with another student, because it's hard to replicate these type of things and the emotional state. I said, when we're counselors, not trained actors. As far as not just mental health counseling, but in general, here's some important considerations when you're creating assignments using AI. And this is generalized to any particular field when you're creating assignments. Certainly, make sure that they align with your learning objectives and contribute to the students' overall development of knowledge, skills, and competencies. Which is to say, make sure that it's appropriate and serving a purpose, not just a novelty. Ease of use. Choose the AI tools that are user-friendly and accessible to students with varying levels of technical proficiency. Um, Most importantly is to provide very clear instructions, tutorials. I'll have a video or an audio recording of me explaining what I want the students to do. For some of this other stuff, some of the assignments that I previously discussed, and then be around to support if needed. Have the students will always have questions sometimes, and they'll send emails about it, and you can respond to that. As far as another important thing for me is always is the ethical considerations. Address any of the ethical concerns related to AI, such as privacy, bias, and transparency, stuff you would discuss in class or online with the students or in a discussion forum. Encourage your students to reflect on these issues and consider the potential implications of AI in their work, both positive and negative. Another consideration is creativity and critical thinking. Make sure you design the assignments that promotes creative problem solving and critical thinking, rather than simply using AI as a tool for automation or regurgitation of information. And that in the three examples that I used, there was always a reflective critical thinking part involved on it. It's not just generating a list or generating a diagnosis or generating a conversation. There's always more for the student to do, to be able to reflect on and think about. Another consideration is assessment. Develop clear and fair assessment criteria for AI-based assignments, considering both the process and the product. When you're doing a rubric, for example, the process, which is just the output, the product, which would be the critical thinking part. And certainly, the more information you give the students, the better, because for some of them, it might be their first time ever interacting with an artificial intelligence application. Finally, the consideration of feedback and iteration. Make sure you give your students timely and constructive feedback. Well, that's good. That's true for anything, really, right? On their AI-based assignments, allowing them to revise and improve their work as needed. Most of the issues I've seen where you didn't give the AI chatbot enough information to generate something. So that's why I asked them to copy everything, that copy and paste to me what they what they type to the in the thing, so that they know. I know, we want to be as specific as possible, whether you're talking about a client or a diagnosis or what type of topic you want to see. Now, some other professions that could benefit from similar AI instructional applications are pretty obvious, and I mentioned all of them, I think. Certainly, medicine and nursing, anything where you're interacting with patients or having to give patients, even something about having to give patients news, good news or bad, more likely bad news, or, implementing interventions or providing them information. In pharmacy, there's always interactions with customers. So certainly, our mental health uh, brothers and sisters in social work. So all of this applies to in that regard. And then, of course, the closely related rehab, school, and career counseling fields could all benefit from this type of stuff, especially the mock counseling parts that I discussed. And that's just about in time. I always like this little piece of artwork. Questions are guaranteed in life, answers aren't. But I'll be happy to try to provide some answers if anybody has any questions. I don't know if there was anything in the in the chat, but
Yeah, nothing in the chat
no.
yet.
Okay, well,
That's okay.
I'll go back to that. Thank you, everyone, for I hope it gave you an idea in my specific field about how AI can be used in many different areas, and all the myriad ways that it can be used in creating assignments, and not just think, oh, students are just going to generate an AI paper and that's that. There's lots of ways to actually use it and leverage it so that they can be comfortable using it to help benefit them and to be able to learn from. And I think, a lot of it is just getting past the the reticence and the for lack of a better word, fear. But the main thing is to be aware that it's not always right, and there will always have to be some sort of human oversight and component to it to make sure that we're not giving your client or patient or student or whomever you're dealing with erroneous information. There'll always have to be some checks, but it makes things a little bit, not a little bit, it can make things a lot easier. But there always has to be some carefully considered, oversight. Thank you, everyone, for your comments. I appreciate it. I adapted a specific mental health one for this for to be generalized, and I'm happy to be able to present and share some of my thoughts.
Yeah, I'm hoping that folks in attendance were able to kind of visualize it for their discipline. I certainly was able to do that. I think it's really applicable across a variety of areas. I was actually most impressed too with when I first read your description, Donna. I was thinking about assignments and how we can use AI for these kinds of simulation type things.
Yeah.
What I did not think about was how the mental health industry, discipline is using this for diagnoses. So that was actually really fascinating.
It's interesting, yeah, and it can make things move along a little bit quicker, to be able to provide diagnosis. Because for students, I find that's one of the hardest things. One of the hardest classes is doing that, where you have all this checklist of symptoms and trying to figure out whether this is a major depressive disorder, or when you're talking about different levels of depression and different types of schizophrenia, schizophreniform manifestations and all that kind of stuff. But it's great in classes like that where you're doing case studies and analyses.
Yeah, absolutely.
Looks like we do have a question in the chat. Was curious if AI can help diagnose Alzheimer's in patients. It is hard when the elderly can present normal in many social situations.
Oh, that's a good question, Jamie, because my mother actually is very early onset, and I've gone with her to some of the tests that they give her, and she's able to get through it, and that's a good and seem normal, although sometimes she doesn't understand what year it is. Of course, I haven't seen anything specific about it, but absolutely, it should be able to, just based on what it would do, say for schizophrenia, being able to analyze speech patterns and the way a person talks, the way a person would write, and a person's gestures. A lot of things. What we're trained as counselors is to look at affect, which is a person's, do they look happy? Do they look sad? And when one of the biggest telltale signs of something being wrong is when there's a disconnect between someone's affect and what they might be saying, which is to say, oh, they talked about how their pet passed away and they're laughing, or they're saying they're really happy but they look miserable. And those kind of that kind of discordant stuff would be easily picked up by a therapist, but also certainly by AI. And there might be other ways, but certainly that would definitely be a good use of it. The earlier the better for a lot of these disorders, that's for sure. And I think AI can be predict to a certain percentage wise, like it was able to predict 80% suicidal ideation. It might be able to say this person has a 72% chance of developing Alzheimer's or whatever it might be asked to identify. So if anything else, it would just give a heads up to a provider about what might be an issue in the near future. But thank you. That being said, if there's not any other questions, I really appreciate it, and I hope you all enjoyed it, and maybe some other people will be able to view this.
Yeah, I'm sure they will for sure. And I'll definitely promote it as well to watch the recordings. This is really helpful because I think it's so applicable to so many fields, helping fields especially. So, yeah. Erin, do you want me to go ahead and share the closing slide?
Sure, that would be great.
Sure.
I'm gonna make sure that you can do that.
There you go. All right. All right. So just as a heads up, thank you for participating today, both to our speaker and to those that participated, joined the session today. We do have a full schedule of events for the rest of the week. So, as long as you register, you can attend the session. So the recordings will be posted on our YouTube channel, and Lauren throwing that in the chat. The link. I've lost my chat. I don't know where it went.
I got it.
Okay. SUNY Open Ed Week is featured on Open Ed Global. You can check out events from this week from around the globe, and that's on the Open Ed Global site. And we hope to see you at another session this week. There's a lot of great sessions. And if you're not able to attend, just go back to that YouTube channel and check out the recording. So thank you so much, Dr. Nowak, and everyone have a great week.